Hi, I'm Carrie. I'm the lead for advanced care planning at Fraser Health. We at Fraser Health have supported advanced care planning throughout our health authority for healthcare providers and the public for almost 2 decades. But what do we do? Well, let me tell you a bit. We have a nurse and a social worker working in pairs in each of our subregions, building relationships with organizations outside of healthcare, places like the Clearbrook Library and Church, the University of the Fraser Valley, School of Social Work and School of Nursing, the Abbotsford Association for Healthy Aging, and also places that help people with life planning. And also in our healthcare system, we're out there providing advanced care planning support to our frontline clinicians. But what do we do with all these places and people? We provide free education sessions and can support you to walk through the steps of advanced care planning, provide you with tips for talking with your family and friends, your doctor, your nurse practitioner, social worker, and others on your healthcare team. What's important to remember is that advanced care planning is for everyone, healthy adults as well as those who may have health issues and conditions like diabetes, heart, or lung disease.
Hi, my name's Randy and I'm the social worker with the Advanced Care Planning team in Fraser East. What is advanced care planning anyway? Put quite simply, it's planning in advance for your care. The planning aspect of advanced care planning is not a lot different than planning for a vacation. Where do you want to go? What do you want to be able to do? And how much are you willing to go through to get to your destination? Planning for your health care in advance helps ensure that you'll get the kind of care you want if and when you need it, even if you aren't able to speak for yourself. Unfortunately, accidents can happen, and we could need hospital care without notice, so it's best to be prepared. Your own personal advanced care plan should be reviewed periodically because life changes, and so does your health and who's involved in your life. So it makes sense that your wishes regarding your health care might change as well. Advanced care planning involves 5 easy steps. Step 1, think. Think about what types of healthcare treatments you would or wouldn't want. Think about who you might want to speak on your behalf. Step 2 is learn. Learn more about your health and treatments and the procedures that you may decide on down the road. You'll also want to learn a little bit about the law and how a substitute decision maker would be chosen if you don't choose one for yourself. Step 3, decide. Decide who you would want to speak on your behalf if you couldn't make your own decisions. Step 4 is talk. Talk to everyone who is important to you about your wishes and your desires. This includes your family and friends, your chosen representatives, your family doctor, as well as your healthcare team. Step 5 is record. This is where you put it all together. You'll want to put your representation agreement, advance directive, do not resuscitate order, all in one place. Nav is going to talk to you about where to put these documents. They go in a small folder called a green sleeve.
Thanks, Randy. My name is Nav. I'm a nurse clinician with Fraser Health Advanced Care Planning Team. मेरा नाम नवजोत है. मैं Fraser Health Advanced Care Planning Team नाल काम करती हाँ. A green sleeve is like a healthcare passport. It is green magnetized wallet for the fridge and holds a list of your medications, substitute decision makers, and any advanced care planning documents. So this is the green sleeve. is magnetized, and you can put the most and CPR documents in this. Take your green sleeve with you to the doctor, specialists, all clinic appointments, and to the hospital. The information inside of the green sleeve helps health providers know what planning has been done and provides a starting point for the conversations that need to continue. You can connect with the Advanced Care Planning team for a green sleeve by phone or an email. You can find Advanced Care Planning information on Fraser Health site. Here you will find information about choosing a substitute decision maker, medical interventions such as cardiopulmonary resuscitation, or also known as CPR, or other life-supporting treatments, medical orders such as medical order for scope of treatment, or also known as MOST form. You can also learn about and request a free public information session that will help people in our communities start the advanced care planning process. The things we usually go over are in our session. What is advanced care planning? What should I start planning? What kind of things do I need to think about? Who would be a good healthcare decision maker if I can't make my own decisions? What are the laws about this? We also support healthcare providers to learn about advanced care planning. The Fraser Health Advanced Care Planning team is here for you. Now I would like to turn it over to Dr. Ken Dueck, who has great tips on how to bring up and discuss advanced care planning with your doctor and other health professionals.
Hi, I'm Ken Dueck. I'm a family physician in Abbotsford, BC, and I'm part of a team. We're called the Older Adults with Complex Conditions Shared Care Project. We're a group of nurses, doctors, social workers, and other care professionals working together as a team to try to make things better for seniors. You've just heard from Nav, Randy, and Carrie from the Fraser Health Advanced Care Planning team. They're part of this group. Thanks to each of them for that great introduction to what is involved in planning ahead for your future healthcare. You know, I've had the privilege of providing medical care to folks of all ages and walks of life over these past 30 years. And during that time, I've often seen families of my patients having to make really tough decisions during a time of crisis. At some point, you may be in a situation where you cannot speak for yourself. You may be unconscious or confused, and then one of your loved ones will be asked to make decisions for you. They could be put in the place where they have to decide whether to put you through surgery or other procedures, sometimes when it's not even clear if the treatment will be helpful or not. Those are really difficult choices to make for someone else, especially during the stress of an emergency. One of the best gifts that you can give to your loved ones is to document your wishes in advance. Then if something happens and you can't speak for yourself, it will still be clear to everyone what you would want. You're taking the pressure off your loved ones. You're giving them the comfort of knowing that the actions taken by the medical team match up with what your wishes were beforehand. Now, there's many people who can help you, like the people you've heard from earlier in this video. But a primary care provider, like your family doctor, can also support you by answering questions, by discussing your goals of care, and after conversations with you, completing what's called the MOST. This stands for Medical Orders for Scope of Treatment, and the form provides direction for your medical treatment options, which can range anywhere from simply focusing on comfort in your care, all the way to intensive care, with the use of CPR and ventilators if needed. Often your family doctor will start a goals of care conversation with you when you're in for an annual physical, or it could take place during a shorter office visit, and sometimes that conversation can continue over several visits until you feel comfortable that you have clearly sorted out your wishes. But what happens if your doctor doesn't raise the topic and you want to have this kind of a discussion? Well, here are some questions you might bring up to get started in having a goals of care conversation with your doctor. Now, some of these might fit for you and some may not, but that's okay, because they're just some ideas to get you started. So, you might ask, do you have any information in my chart about what I would want for my medical care if I can't speak for myself at some point? Or which of my health conditions are easily treated? And maybe more importantly, which are not? How can possible treatments improve or maybe worsen my quality of life? Or do you think CPR would still be effective at this stage, given all my health conditions? What if your doctor's behind that day and seems to be in a hurry? Remember, this is not a conversation to have under pressure. Well, you might say, I've been thinking about my health situation and I know that you're really busy today, but can we schedule a time to discuss advanced care planning? And is there anything in the way of preparation that I should do ahead of time to help that discussion? I promise you, your doctor will really appreciate you taking that approach. Remember, advanced care planning is not a one-time decision. It can evolve as your health changes. Advanced care planning. It's about thinking ahead and being prepared.